My PSA count had jumped up to 5.5. So he sent me over to a urologist who's Dr. Bivens, who's a member of UCA.
I think critical to this right now is the screening process. If you are 50 years old, you need to be getting checked. Not only do you need to be getting checked, but you need to know what your PSA is. And if you don't know, you need to call your doctor up.
Because, see, at the time, I didn't have any symptoms. I mean, I was not symptomatic at all. The only symptom I had was my PSA.
And typically it's above 2.5, and typically the patient is less than 70 years old. I sort of kind of tailor that according to their age after 70 years old. And then I'll sit down and I'll talk about a biopsy, go over the risks and benefits of a biopsy. The actual benefit is that we can diagnose cancer and potentially cure you of cancer. That's the true benefit of it. The risks are minimal. Infection, but we protect patients against that by giving them antibiotics. Bleeding, that's a very rare risk. And then having a negative biopsy, because then it presents confusion, which can be a risk. And to expound upon that, that's a huge area, because if a patient comes in elevated PSA, and then they have a negative biopsy, then the question is, does that patient not have cancer? And the answer is, I can't tell them they don't have cancer. What I can tell them is that they don't have cancer in the areas that I biopsied. And that presents some of the controversies of the PSA, which is a huge controversy right now. As we know, PSA is not the best test. It is not a good screening test at all if you look at screening tests. However, it's the best test we got.
I tell everybody I know, and all the females. I even tell females, tell your husband that you will forego your next birthday gift, anniversary gift, or whatever if they'll just go to the doctor.
Dr. Bivens did the biopsy. A week after that first visit with him, a week later he scheduled the biopsy on a Monday, and that Thursday he called me and told me the results were positive, which kind of threw me for a loop, because I wasn't expecting to hear anybody tell me I had cancer.
Robert called me and said, Althea, we need to talk. So I knew that the news was not going to be good. And so we talked about it for a few minutes about the surgery, the robotic surgery. And then Robert called Dr. Bivens, and Dr. Bivens talked to us as long as we needed to talk.
Went through just did a lot of discussion, talked about all the treatment options, talked about the robotic surgery. He told me he was explaining that if I was going to do surgery, this would be the way to go.
The first thing I do when I counsel a patient is I really want that patient to bring in his family.
I think the thing that's most important to me is that you need to be involved, and that's what I tried to do. Be involved by going to every appointment.
Sometimes patients, when you first tell them they have cancer, they may not hear anything beyond that point, and having a family member there will certainly be there to hear things that they may not get.
Because I knew that Robert was, just beside himself, the fact that he had cancer, and he would be in those appointments not hearing everything that he needed to hear, and I figured I would be a backup. I think that one of the important things to do during your recovery process is to make sure the men take advantage of the nurses that will help them with the impotence that may be temporary, it may not be temporary, but at least go through the process of coming up here and getting the aid that you need to make sure that process of recovery gets to work. And make sure your husband, whatever he needs to do, whether it's to take medication, or use the pump or whatever, to make sure that they do that. And encourage them and just make them feel good about themselves, because you would rather them be here than not be here.
Because the sex and the incontinence were not primarily on my mind. That was not the main focus for me. My thing was, I got 2 kids. I want to hang around for them. I want to hang around for their grandchildren. So those 2 things were not, sex and incontinence were not the primary factors on my list. It was, my thing was, am I going to be done with this? Am I not going to have to deal with this anymore? If that's the case, let's do the surgery. We'll worry about the after effects later.